everybody, this is my friend Kaiser. Remember her? Okay, her story. Her, what's her why again? Huh? Ice skating. Her why? What drives her to physical therapy? Okay, you always have to ask yourself, what was the straw that brought the camel's back that made them come to physical therapy? Right? Because everybody has pain. It's just whether like what's the final reason. You have to use that. You have to use that. So essentially, obviously she has a passion for ice skating, right? And if she can do that, right, that would drive a person to come for assistance. Okay? So, can you stop, please? So what have we ascertained from her? Okay, we figured out that her L5 was the hypermobile, right? Remember, she hinged like crazy in extension and right side bending. Okay, when you move so much that what happened? Tingling down the leg and stopped over here. Okay, and we thought it was S1 because S1 myotome was weak, S1 reflex was weak, so everything was screaming S1 is getting compressed because this L5, right? And then pathomechanically, extension instability. Okay, everything was worse with extension. And also we did a story test to confirm that everything was what? Responsive, okay? So let's do a quick driver test, okay? So keep face that with me. Okay, so ready? Bend backwards. Tell me when to touch ready. Right there, okay? So what am I going to do? Bend forward, bend backwards. Tell me when. There. Alright, what's next again? Number spine. So I'm going to find a signal over here, extra here. Which one here? Okay, ready? Bend backwards me. Bend.
Right there.
Okay, so that was better, right? What am I going to do? Go down one more segment. No, don't move, sister. Remember, I gotta get the motion first, then move, right? Go ahead.
No pain.
No pain. Okay, so L2, L3, hypermobility. So definitely gonna do a breakout there. I think that's gonna be the primary so far, right? Then check out the IPT, and then bend backwards, please. Does that help? But not as much as the other one, right? Yeah, I can just tell. I don't even ask the patient. I can tell, all right? So then, our right sacral base is more prominent. Remember that one? The butt muscles is tighter or something like that, right? Bend backwards, please.
That's no pain.
No pain. Oh, now I got hit, okay?
Sorry.
Coming back, right? So this one and that one, all right? And then also she has some hip issues, right? Remember that? And backwards. All right, hip especially. How's that?
No, it's good.
No, that's good. Okay. So we have a battle here between the upper lumbar, SI. We're going to do upper lumbar. We're not doing SI yet. Okay. So we're going to figure out two things. Okay. Okay. So what's confusing for her, right? Her pathomechanical is it's a extension stability, right? So I need to do what? Do a stress test here, and then do PIVMs over here. Okay? Yeah. Okay, so let's do our stress test. Okay? So do me a favor. Can you sit over here? Okay? Right? So if this is anterior and this is posterior towards me, okay? So we're going to check for the following, right? Anterior, posterior, lateral, and rotation, okay? Okay? All of them. Doesn't matter if you have a flexion or extension stability, you're checking all of them just for the sake of being thorough. Okay? The first one, a little bit craziest one, okay? We're testing for posterior. Not as common, okay? So you think about it, how am I going to test posterior stress test? You know, you can go through the belly and do a posterior glide, right? That's too tough. You can, release the psoas, do different things. That's too much work. Plus, she's ate lunch, right? So instead, we do the whole function unit concept, where we're gonna make the top half what? One unit, one segment, and then we're gonna push our whole upper body posteriorly. And as I'm doing that, I'm holding the inferior segment. Okay, so you see the concept. What's our goal here? Top unit moves one segment, I hold the inferior segment. Okay. So, can you do this? Okay? And when she does, you put this on my chest like this, right? And then my hands here goes to the inferior segment. So I'm going to go to S1. Like crest, L4, L5, L5, for an S1. See, I'm holding S1 and I'm pushing it which way? Anteriorly, okay? Then I want L5 to go this way. And how do I do that? I tell her to push me away. When she pushes me away, what happens? She does a relative posterior glide. And nothing happens, and nothing should happen. Okay? So the key here is that she doesn't do that. Push me away again. She doesn't go to a posterior pelvic tilt. Go to a posterior pelvic tilt. Right? Because if you do that, you think everybody has instability. Okay, that's an osteokinetic. Our goal is what? Orthokinetic, right? So my hand here goes to superior segment. My other hand here goes to inferior segment. And I'm feeling for this. Do I feel my top hand go more posteriorly? Or does she experience pain? Okay, ready? Push me away. And that's it. Then I slide up one more segment. Push me away. And then that's it. Okay? Always test 2 to 3 segments. Okay? Yeah.
Can you do that one more time with her facing that?
Oh, sure. Face this way.
Thank you.
Hands like this, okay? I come around like this. My hand over here is on S1. My hand over here is an L5. When she pushes, positive, my top hand goes posteriorly. So, push me away nice and easy. Alright, and that's it. Nothing happens. This test is rarely ever positive. Okay? That's a posterior stress test. Now, we're going to do an anterior stress test. So this one here, lying side. Yeah. So, what I'm going to do now is I'm going to move her like this, and I'm going to take her legs, okay, and push them this way. By me doing that, the inferior segment is going posteriorly, and the superior segment is going anteriorly. So this is why this is an anterior translation test. This one's positive quite often. Okay, so what am I doing here? You bend your knees, please. And then what I'm doing, can I double check? Okay, it's easy. Okay, so S1, L5, right? So you see what I'm doing here? I'm taking the legs, I'm flexing it until I feel motion at the segment, and then my legs, see what it does here? I push her posteriorly, right? Which is what? A relatively anterior glide of the superior segment. Remember, motion's always based on the superior segment, right? So, once again, 2 hands here, and ask myself, do I feel this unevenness, okay? So you see how my hands are lined up right now? When I push, you see how my bottom hand goes more posteriorly than the anterior hand? You see that? That's a positive test. For anterior translation, which makes sense, because all our symptoms are suggesting anterior translation. Make sense? Okay? And then what I do, slide my hand up, go to the next segment, right? Flex your legs a little bit more, and do the same thing. That one, no motion. Look at that. No motion. Go over here, go back down a little bit, and then look at that motion. Okay? You have no idea what you're feeling unless you compare it to the superior segment. Okay? So that's definitely a positive over here. Yeah? Yeah, yeah, yeah. Alright, and for fun, whenever you get a positive, you have to ask yourself, I wonder if the muscles are strong enough to stop this, alright? So, if she was able to turn on her transverse abdominis, for example, okay, turn on your transverse abdominis, please. Turn it on, and repeat the test. And you see what happened? The test is less positive. Don't turn on, don't turn on. Look at that motion. You see how the pelvis is moved posteriorly like crazy? Turn on your muscle. Much less. Okay? So that's a good prognosis that means her muscles are good enough to stop this motion if we work on it. Okay? Remember, your whole goal is to think prognosis. So if you have somebody who has stiffness here, that's bad prognosis, right? Because double tightness, right? Or what's the worst scenario? Instability every direction, hypo here, none of the muscles working. That's pretty bad prognosis, right? In her case, her stuff was mostly over here and also over here, so she had a double whammy, but at least her muscles were able to stop this. Okay? So, that is anterior glide. Next thing is lateral translation, okay? It's very hard for us to do only one segment, so we do all the segments together. So what you do is you take your forearm, go above the iliac crest, okay? Between the ribs and the iliac crest, you push straight down, nice and slowly, and you ask the person, there's only one, we go by pain. Do you have any pain when I do that? In the spine, not where I'm touching.
That's where you're pushing.
Right? Make sure you ask them, not where I'm touching. This is uncomfortable, right? Because if this was unstable this way, it won't like this translation. Make sense? Hmm?
What do you do with your hands?
Or you're just pushing this way. Push like that, alright? We're nice and slow. Any pain?
No.
Okay, good. Alright, the last thing is rotation. So you take this hand over here. Okay? So I'm holding S1, then I go at L5, and what am I doing? Twisting, right? See that there? Just twisting, right? Then I'm gonna hold L5 with this hand, and then go L4 over here, and then I'm gonna twist. And then twist. What am I doing? I'm just holding the inferior segment while the superior segment is rotating. I'm holding her here, then I'm twisting. Holding her here, and then twisting. Yep.
Won't there always be some rotation because nobody naturally want to rotate, so it would be like extreme that you feel?
No, actually, the lumbar spine has almost no rotation, like 1 to 2 degrees. Most of the rotation comes from the thoracic. So when I'm doing this, you have to ask yourself, am I getting this from the thoracic, or am I getting it from the lumbar? So that's why it's so important to stabilize it, the inferior segment, go to superior segment, and that's it. Just nothing there. Boom. And that's it. Okay? So, I'll do the same thing on the other side. Get the head over here, always. Face me. Okay. And I'm going to do this same test over here. Any pain to the back, now where I'm touching? No. Okay, now I'm doing my rotation. Drop here. Inferior segment. And that is rock solid. Remember, I stop when I feel motion here. I don't keep going to get the thoracic. I'm just doing the lumbar. Not solid. And that's solid. Okay, so her stability comes from which one? Anterior translation. All the other guys are fine. Okay? So after I do my stress testing, what do? Then you do your PIVMs for the adjacent segments. So since her thing is stiffness and what? Extension, what do? Extension PIVMs. You guys learn extension PIVMs? Is that the word? Yeah? Yeah? Okay, good. So you just do extension PIVMs, right? So just quick recap. The person should be screwed up much more closer to the edge. Okay? We flex the knees all the way. Why? So the rectus femoris is tight, so when I move just a little bit, it pulls the pelvis into antipelvic tilt, which causes an extension. Because if you have the legs like this, look how far I have to go before I get extension. Way too much work for me. So that's why keep it flexed and you extend like this. Okay? But I'm much older and lazier than you guys, so I like to extend from above. This is the extension. This is the extension. This is the extension, right? So you see this extension and what? A little bit of rotation, right? Yeah? Okay? And all these guys here, they extend no problem. Oh, no, this one here, that's the one we found standing. This one, doesn't extend. So this one here, I'll have to mobilize.
Is it tender?
Hmm?
Is it supposed to be tender?
Yeah, because when it's hypo, I'm trying to force into extension. Like, hey, I can't do it. Okay, so I need to do what here? I need to mobilize this, and this guy over here. We know unstable. We know the multifidus wasn't working that well for her, remember, and transverse. So she needs multifidus training, transverse training here, and mobilization up here. Yeah? So it seems like a lot. It's just, you've done this before, except for the stress test. Alright? So, since I'm here, I'm just a mobilizer, okay? No, we haven't learned mobilization yet in extension here, right? We did flexion. So let's hold it from that. Let's just practice the stress test.